So there we go. So good morning, everybody. Welcome. I'm Bert Jackson. I'm the CEO of the Cape Cod Technology Council. Welcome everybody today for our coffee Q&A with Dr. Thomas Freddo. We're happy to have Dr. Freddo here talking about some interesting technology around temperature scanning for COVID. So first of all, just want to give you a heads up about what's coming up. We do these coffee Q&As every Friday that we don't have a first Friday. So usually 3, sometimes 4 times a month. Next week, we've got Lindsay and Brianna from the Cape Light Compact talking about some of the impacts of COVID on energy efficiency. The 23rd, we're not having our usual coffee Q&A because it's the Net Zero Conference. And if you haven't signed up for that, it's free. It's a 5-hour conference with 3 tracks on everything from energy policy, environmental issues, and also how businesses can leverage green technologies to help save the planet and save some money at the same time. On the 30th, we have Amanda Kaiser from F.A.A.O talking about the accelerator program. And then on November 6th, we've got the Cape Cod Community College for our first Friday talking about the new science building that's happening at the community college. So with that, I'm going to turn it over to the chair of our programming department, Robin Orbison, who's going to be our moderator today. Robin?
All right. Thank you, Bert, and good morning, everyone. I am very pleased to welcome Dr. Freddo this morning. He has a resume with far too many accomplishments to list in the hour that we have here, so I'm going to just hit some of the highlights. He has spent 25 years as professor of ophthalmology at the BU School of Medicine, simultaneously while being the director of surgical eye pathology for both Boston Medical Center hospitals. He is on the editorial board of 2 major medical journals, has published over 100 articles and other materials, including a textbook on eye anatomy, which led to his connection to the manufacturing industry that is currently heating up because of COVID and putting on the market products that are helping businesses and employers with temperature scanning of employees in a touchless manner. So without further ado, I would love to welcome Dr. Thomas Freddo here to our Q&A. Good morning, Dr. Freddo.
Good morning. Thanks for inviting me.
Well, we're delighted to have you. So let's start off by talking about why we're talking about this topic. Why tell us about how temperature scanning as a topic has evolved since before COVID. How has COVID impacted the importance and relevance of thermoscanning technology, and how has those who are developing the technology responded to the urgent needs brought on by COVID?
Sure. Let me see if I can get my slides to change here. Before we go into the CDC stuff, this need to measure temperature came about, of course, because there were so few signs and symptoms of this disease, COVID-19, that the only thing we had available to check everybody, and this is even before there was a COVID test, was to see if a patient had a temperature or not. And if they did, then you knew something was awry. There were some technologies that had been developed. We obviously have gone from thermometers when I was a kid that were all filled with mercury to more remote sensing technologies. And as soon as it became clear that measuring somebody's temperature, but trying to do it remotely was going to be a desirable thing. Some of that technology was already on the way. You know, we had the devices where you stick a probe in the ear and it measured the temperature of the eardrum. But better technology was needed, particularly aimed at trying to remain at a safe distance from the person being measured. And a number of the companies that were doing really, really high-end remote temperature sensing, for example, industrial applications, like being able to measure the real surface temperature of molten metals or of cooling metals after they had been molded, decided that this might be a big enough market that they began to jump in. Interestingly as well, because it was measuring fever, and that had to do with usually measuring it on the face, a number of companies, mostly from China, that specialized mostly in facial recognition for surveillance, decided that they could add a quick temperature sensing scan to the facial recognition software, and they jumped into the business as well. So that's my understanding of kind of how this all came about. Again, we're still at the point where you can be asymptomatic and still have the virus. And in fact, in those stages, the data would suggest at the moment that at that stage, before you really have any signs or symptoms, you are probably at your worst in terms of, or worst in terms of being able to spread the disease. So it still remains a problem, and by all accounts, this isn't going away tomorrow. And so the CDC got involved. We all know the history of what's happened to its reputation along the road in this because of politics. But nonetheless, the CDC released guidelines for when they got to the phase of opening up America again. The CDC released the guidelines that you see on the slide. The goal here was to try and mount a safe reopening of businesses and other institutions. And you'll notice that foremost among the recommendations is that there be temperature checks. And so that's how this technology ends up being on everybody's list of, you know, we ought to be doing this somehow, but we don't know how. And when I get to that point in the talk, I'll tell you how I end up kind of backing into this technology because of my particular background. You wouldn't think an eye person would be, would be the kind of doctor you'd end up remotely associating with this. So I'll show you later how I ended up backing into this. So as America began to reopen, measuring body temperature at building entrances has now become an essential element to provide public assurance, whether or not with confidence. Of course, we know that it doesn't diagnose the disease, but you can reduce the spread by knowing those who have a fever and those who do not have a fever. And given that this is one of the only things we really can do, the general consensus has been, well, this is better than nothing, so we ought to try and do it. The thought was that it'll be especially important for protecting places where lots of people congregate, like airports and schools and malls and professional office buildings. Certainly medical outpatient clinics, hospitals, town halls, courts, police stations, etc. And it's important, I think, to keep this reality in context. This is, to me, an important graph that everybody should understand. This is the graph of the 3 waves of the Spanish flu that occurred 100 years ago. And we are about to enter the beginning of the 2nd wave. And I think it's important to note that the 2nd wave was far worse than the 1st wave. Now, 100 years on, we have better medical care. We hopefully will have a vaccination available sometime early in the next calendar year. So we hope to take some of the top off of this curve. But if I were to guess, and I'm not the world's COVID expert, particularly the way this has been mismanaged, I think there's a good chance that this coming year will be worse than the year we have just come through in terms of COVID, even if the federal response to this manages to get on track. And it's important to remember, I think, as well, that with the Spanish flu, there was a 3rd wave. And even with vaccinations, it wouldn't surprise me that there will be a modest 3rd wave. So if companies were looking to address the issue of measuring temperature and were looking for something to get their hands on that was going to be really quick, because this is going to be over by winter and whatever we bought we're never going to use again, I think that's probably going to end up being a short-sighted response.
Okay, so I'm gonna ask you to pause there for a second. We got an audience question here. I think, Eldon, I see your question. I think we're gonna hold that until the next part, because I think it's a better fit. So Dr. Freddo, where you just left off, talking about some of these technologies that have come out quickly and cheaply, and some of us feeling like, this is a short-term thing. We're not going to go spend a whole lot of money on it. So I'm one of those people. I went out and bought some of these, so the guns, that people are, shooting you with at the door to scan you for temperature. We were unable to adjust them unless we downloaded some software that was in Chinese and set off all kinds of alerts and bells and whistles on our computer. We had to wipe all our laptops after we tried this thing. And then we tried to send it back, and the company, we had a big fight with them, and they still haven't refunded our money. So I think what's happening is a lot of these products, maybe they work if you're willing to put up with some craziness, but I think some of them are scams and not even working. But at this point, I think would like you to tell us a little bit about, I know your next slide is going to talk about the different types of scanning options that are out there. And there are these quickie, inexpensive handheld ones. And then there are some ones that work better, but maybe a little bit out of the reach of affordability for the average small business. So tell us about that.
Well, I think you're right. I think for most small businesses, if there was something in even the $2,000 to $3,000 range that would be better than the handhelds, my guess is that people would be all over it. To my knowledge, however, there really is nothing right now in that price range. I think people are probably working on it, but right now, your choices tend to be the non-contact temperature devices, the handheld ones like like you've mentioned, and as you can see on the left-hand side of the slide, or moving to more serious technology that allows you to accurately measure temperature, but from a distance of 6 to 7 feet. If you want, I'll go through first the goods and bads of the handhelds, and then we can talk about the other more expensive technologies if you'd like.
That sounds great. Okay, let me just pause for a couple of questions here before we move into that, because that's a very interesting part of your discussion. Question here: how soon after contacting the disease does the temperature tend to spike?
The honest answer is we don't know. It could be within the first day or two. It could be 10 days later. This disease is running a remarkably different course in almost everybody. I think now that we're doing tracking and tracing, or at least responsible organizations are doing it, I think that we'll have a better handle on when we think someone was exposed, because until now we haven't had good data on when were you exposed, and therefore setting the clock on how long from there until you got a fever has been a tough thing to measure. But there are cases where the fever has occurred within the first 24 to 48 hours.
Okay, thank you. Okay, so let's talk about these handheld devices. So, you know, we've all done this, I'm sure, in the past few months, walked into a store or some kind of an establishment, and somebody, you know, comes up to you at the door and, you know, shoots you with one of these handheld devices. How safe is that supposed to make us feel? What are the pros and cons of these things, and should we feel a sense of security if a business is doing these handheld temperature scans as people walk in?
Well, there are advantages and disadvantages, as there are with virtually everything. The benefits to the handhelds, if they're good ones, and you're right, there's a lot of really cheap knockoff stuff coming mostly from China. And with any of the instruments that are from China, and I don't know how, I'm no security expert, but as you've heard from the federal government at least, there are expressed concerns from some quarters as to whether or not the software in any device can be trusted to not be a potential security breach or some other problem, even if it's just with your software. The benefits of these, if they're good quality ones, are that they're easy to clean and disinfect. They measure temperature and display the reading rapidly. And they provide the ability to retake a temperature quickly and have the advantage, of course, that they're low cost. The disadvantages are that how and where this instrument is used can dramatically alter the quality of the reading. The other disadvantage, of course, by definition, is that even if you're wearing a mask, you can't both wear a mask and properly socially distance and use this technology, because you can't measure the person unless you're basically right up next to them. And the other business concern is, I know that at the medical center I use here in Westport, there are 2 or 3 or 4 people out front of the building using these devices before you can get in. And so that means you've got 4 people on the salary on your books who are basically standing in front of the building all day long, measuring temperatures. They're not socially distancing from all those patients coming in. And you're increasing, I think, your liability risk to an extent because you've got all these people in contact with other people, putting them at risk. I honestly don't think, particularly at my age, I would want to be the person who is standing in front of the door of a medical clinic sampling temperature on everybody walking in for who knows what kind of visit that day. So it has those downsides.
Can you, could you just elaborate a little bit more on what you mean by where and, I forget what that slide said, but where and how the NCIT is used? How
Yep.
does, yeah.
The environment in which these instruments are to be deployed can dramatically affect their performance. The recommendations usually are that it be used only in a draft-free space, out of direct sunlight or other sources of radiant heat. Typically, the environmental temperature for appropriate use should be not lower than 60 or 61 and not higher than 104, with a relative humidity that is not below 85%. That's actually tricky to do. And if you're standing in front of a building where people are walking in from a parking lot on a really hot day, then they're going to be sweating, which is going to interfere with the reading, or at least their forehead is going to be hotter than their core body temperature. And it's only the surface temperature that you can read with this. And the same thing's going to happen, but in the opposite direction come winter. If the measurements are still being done outside, and that is walking in from the parking lot, your forehead is going to be cooler than it would otherwise have been. And we run the risk in the winter, when things probably will get worse, of measuring false negatives at the door with these devices. Generally, the instrument is supposed to be equilibrated for 30 minutes before its use. I honestly have not seen that being routinely done. So the good ones, at least, will measure within plus or minus 5 degrees Fahrenheit, which is pretty much the standard. But an awful lot of them are less accurate. And calibration for this technology is really critical. The devices should be cleaned after each use, which of course is going to require an endless supply of disposable wipes. The FDA recommends that persons using the NCT ensure that the tested person's forehead is clean, dry, and not blocked at all during the measurement. I certainly have never seen anybody using this technology that is all that interested in blotting the forehead of the people in front of them before they do a measurement. In addition, the FDA cautions, this is not just general, that the FDA cautions that the NCIT sensing area must be perpendicular to the measuring surface of the instrument. And you need to instruct the person to remain stationary during the measurement. And this is often tough to do when the taker and the subject are different heights, or you're trying to bend over and measure the temperature of somebody who's in a wheelchair. The distance between the NCIT and the forehead is specific for each NCIT. So it's not a matter of just holding it up and pointing it sort of at the patient's forehead and clicking the button. You'll get a number, but it may not be an accurate number. And again, importantly, the sensing area of the NCIT must be kept clean and dry. That is, of the instrument, not just the patient's forehead or the subject's forehead. Experts have confirmed measuring the forehead or even the neck. Some people use this device to measure the neck. That these measurements on forehead or neck with a handheld scanner will of course record only surface temperature, which is always less than core temperature and is prone to vary with sweating and whatever the ambient temperature happens to be at that point. Or if you're outdoors and there's a breeze, that can dramatically alter it. And so it's factual to say that this method is not the method that has been recommended by the US FDA. The USA FDA recommendations are that people be screened one at a time, that they preferably be screened remotely from a distance of 3 to 7 feet away. And then here's the part where I end up getting involved in this, because I happen to be at the moment the author of the most widely read text on anatomy of the eye. And that apparently brought my name to the attention of the people working on the instrument of the company I'm consulting for. It turns out that the FDA recommendation is that the best way to get closest to body core temperature is to measure temperature near the tear ducts. So I'm going to go real close here. So it would be basically measuring temperature in this circle between your nose and your eye is the area of the body where you can get the closest approximation of body core temperature. And that's what prompted my phone to ring, because the company wanted to know more about the anatomy of this part of the body. FDA goes on to recommend that you perform secondary screening on individuals, of course, with elevated skin temperature using a more accurate and indwelling type of device that will give you something closer to core temperature. And if you listen to the lawyers, this is a quote from one employment law firm. Their recommendation is that best practice is to use equipment that requires no direct contact between the temperature taker and the employees. Scanners that can measure temperature remotely are ideal. So that's kind of where the FDA is. That's where at least the lawyers that I've been able to talk to are in terms of this. And of course, the big problem is that if you move from the technology of the relatively cheap handhelds, it's not like the next step is only $400 or $500 more. The next step is unfortunately quite a big step.
Right. So just before, and yes, before we talk about that next step, can I just ask you, you mentioned a couple of times in your talk there about the NCITs, you said you make reference to the good ones. In other words, implying that, you know, there are some that are, even though with all of the drawbacks of NCITs in general, there are some that are better quality than others. How can a small business, you know, make that decision? Is it just the higher priced ones? Are there manufacturers that you'd recommend, or are there features that we should be looking for?
This makes me feel like the world after World War II when I was growing up, where you basically said, buy American made. But I think if you can find one that is American made, you're more likely to have a technology that is more reliable. There is an enormous amount of really cheap stuff coming in from China right now. And particularly with with the technology concerns that we'll talk about later regarding the more expensive instruments. I think if you can find one, and there are so many out there now that I've lost track of any of the brands. So I can't even really recommend to you a brand in particular. And honestly, because I've been involved in the other technology, I haven't had much experience personally with the handhelds. But
Okay.
I would say probably the higher end is better. And if you can find something that was made in the States, you're probably safer than buying something that has come in from China.
Okay, thank you. All right, so so now tell us about the more expensive versions, the remote technology that that you're more involved with.
There are two systems out there right now, or two basic types of what are remote thermal camera systems out there. The least expensive thermal imaging systems will measure only forehead temperature and measure it on the fly. So if I can get this video to work, I'm hoping. You'll see people come by. And according to the FDA, thermal imaging systems have not been shown to be accurate when used to take the temperature of multiple people at the same time in a moving crowd. Like NCITs, these do not comply with the FDA recommendations. And in addition, most of these are made by Chinese companies. There were 2 or 3 of them at one point. 2 of them were actually owned by the Chinese army. And these companies come into this situation having first come in through the door of facial recognition. These companies really have an expertise in facial recognition and just added basically an infrared system to their facial recognition cameras. And so you can see that the technology is really about facial recognition, and then you put a thermal overlay and it will pop up these temperatures. But again, it's surface temperature only. And about 2 months ago, between the time that I agreed to do this and today, most of the companies making this type have actually been banned from the United States because there were concerns that the software in these, particularly since 2 of the companies were basically subsidiaries of the Chinese army, had technology in them that could serve spy purposes, whatever that means. And so these are most of the technologies that were originally out 4 or 5 months ago that are based on this concept of kind of measure, because initially the hope was, particularly for places like airports, that you could measure people on the move, get accurate measurements, and then just target the people who popped up as hot. But it's now pretty clear, the FDA has come down pretty clearly that this technology really doesn't comply. The subject has to stop. You have to try and measure the temperature in that specific area in order to really get a serious reading that you can take as being as reassuring as we all hope such technology will do. So again, these are the FDA recommendations. In the upper right-hand corner, you can see the ellipse representing the area that would be the ideal area to get that measurement in order to provide the maximum reassurance that the technology is really giving you the number that you want to have. Let me show you how the other technology works. Again, the ideal systems follow the FDA guidance, one person at a time. Their glasses have to be removed because you need a clear sight to the area between the nose and the medial side of the eye. These technologies include AI software that will search and automatically identify that particular area of the subject's face and will make a temperature measurement from only that area. The measurement is taken only from the pixels in and over the tear duct area. And these also have an option to preset a fever cutoff that will give you an audible alarm. Their accuracy is about plus or minus 0.5 F. And I should also mention that the technology for the moving crowd, facial recognition kind of stuff, is plus or minus 5, but it's plus or minus 5 centigrade, which is a broader range than plus or minus 5 Fahrenheit. So the advantage to this is that you could pretty much put it, if you've got a building that has a security guard, you could have people come up and basically be scanned one at a time, and the security guard could actually be doing other things because you can set this for an audible alarm so that if somebody comes up while the security guard is distracted with something else, there'll be an audible alarm if a temperature above whatever you have preset comes up on the screen. I'm going to show you this clip now using this technology, and I'll play it twice because I want to bring your attention to something on the second round.
Just stand there with your glasses off.
So let me call your attention now to the computer screen in the thermal image. And you'll notice that there's a circle on that image. So the artificial intelligence software has found this location on the subject's face and measured the temperature only within that circle. So only the pixels within that circle were sampled for the temperature, and the temperature is then presented on the screen. It takes about 2 seconds for each subject. And the advantage, of course, is that masked or unmasked, the two people involved are never within closer than 6 feet to each other. So that's the high-tech option for this. And those are available from probably 2 or 3. There are probably new people coming into the market. But from 2 or 3 companies have this technology that includes the AI. And at least the last time I checked, and it's been a few weeks, this company that I happen to be working with, I think, was at the lower end of the cost curve. on providing this technology. So basically what they provide is they provide the camera, the stand, the software, and the cable. And if you plug it into your laptop, and you won't get any screaming messages from your computer telling you, oh my God, what did you just do? It will just interface, and there's a 24-hour tech support line that's available to go with it. Benefits of this tech, go ahead.
Dr. Freddo, we have a couple of questions here. So can you give people a sense of what the range of cost is, sort of the lower end up to the higher end of these devices, these systems?
They're probably the lower end of the instruments that are designed like the last one, not the moving crowd type, start at probably 12, and then they go up to
20,000.
Yeah.
Yeah, so
Yeah.
very prohibitive for small business. We're also getting a question here.
Well, there's also, and again, I don't want to turn into salesman here, but most of these companies are offering financing, usually at pretty good rates, and basically it becomes a mortgage rather than a large single capital outlay.
And where are these being manufactured?
Some are made in the US, and the other big company that is producing this technology is in Milan. And the company in Milan has provided all the sensing instruments for most of the airports in Italy and most of the airports in Spain. And I don't know what's happening with the rest of Europe right now. But they make the two companies, the main two companies I'm aware of at this level, make several versions of this. What I just showed you was the version that you could realistically afford to privately own. They have bigger versions, of course, where the thing is built into a basically a channel like you would enter if you're going on the subway. So it would basically bring you to a starting block and measure your temperature, and then the bar would go up and you could go. And that way nobody has to be directly involved. So if there's a gate that only opens if the temperature is right, you can run this technology with one person operating several of these and just going up to each individual for whom the gate won't open.
Okay, great. We do have some more questions coming in, but I know you're on your next to last slide, so I think I'm going to let you finish going through your deck, and then we'll take all the rest of the questions.
Okay. The benefits to the technology I showed you at the end are that the person who handles the thermal imaging system is obviously not required to be physically close to the person being evaluated. In fact, the person who handles the thermal imaging system could even be a completely different area, different room, probably in a different state, if there was some way to then convey a message that somebody showed up hot on the imaging. The thermal imaging system may measure surface skin temperature faster than the typical forehead or oral thermometer that requires a close distance. And scientific studies show that when used correctly, thermal imaging systems generally measure surface skin temperature accurately. The limitations, although the systems may be in use for individual initial temperature assessment, to triage individuals in high throughput areas, they've not been shown to be effective when used to take temperature of multiple people at the same time. So that moving technology just is not, you'd spend $8,000 on that technology and basically give yourself a false sense of security. Whereas if you spent 2,000 or 3,000 more, you'd get something that had all the bells and whistles, including the AI for sensing the medial part of the eye. These systems still measure surface skin temperature, which is usually lower than the temperature measured orally. And they have to be adjusted properly to correct for this difference in measurement. And the best systems are the ones that have the AI software that locates what's called the inner canthus, where your two lids, upper and lower lid, come together, is anatomically called the canthus, C-A-N-T-H-U-S, plural canthi, C-A-N-T-H-I. So you have a medial canthus and a lateral canthus. And within your medial canthus are the tubes that drain your tears away. And it's that area in the medial canthus that is the area that best reflects the underlying core temperature. These systems work effectively when the following things are true. The systems are used in the right environment or location. The systems are set up and operated correctly. The person being assessed is prepared according to instructions, meaning stand still with your glasses off, and that the person handling the thermal imaging system is properly trained. The training on these is pretty minimal. The higher end systems that have you stop, take off your glasses, and have the AI to measure the medial canthal area are pretty easy to set up and run. As a final note, though, calibration of these instruments is critical. And some of the cheaper ones, are really designed to keep calibration for only a few months. And the problem is that they can't be recalibrated. So if you were going to spend the money on this technology, I would push whatever representative you're talking to and say, you know, can it be recalibrated? And if they say, oh, well, it's not a problem, you'll never need it to be recalibrated, press them on it and say, okay, that's fine. But if I really was anxious and told you I really wanted to have it recalibrated, even at my expense, can it be done? And there are a surprising number of companies where pressed to that will end up having to say, well, actually, no, it can't. It can't be recalibrated. Whereas the better ones can be. They're generally, some of them are calibrated just against a spot on a wall, and some of them are calibrated in a lab with more rigorous standards. And if you can get one that has been calibrated really under lab situations, I think that's, if the goal is to get the best you can get, then I think that's probably what you want.
Okay, so we are we're at about the 5-minute mark. Maybe if you want to just cover your last slide quickly, we can get a couple of questions in.
Sure. These just repeat what I've talked about earlier, and that is, it's clear that the preferred solution to achieving compliance with the FDA recommendations and reducing risk of viral transmission while also reducing liability is the thermal scanning system that complies with all the FDA recommendations. And on the right-hand side, it just reiterates what those recommendations are. And then I've thrown in a whole bunch of reference material that you can get to read about this stuff for yourself from reliable resources.
Terrific. All right, so we had one question earlier. The question is, what do you think about the possibilities for, what do you call them, fitness watches, these devices that people are wearing on their wrists? How do you view that technology in terms of being able to give people accurate readouts, and is that technology being developed at all?
I don't know. I don't have a strong connection to that technology. I am consulting with a cardiovascular company at the moment that is developing a wrist-borne device that will do a continuous wave measurement of blood pressure 24/7. And with a remarkable new technology that doesn't require inflation of a cuff. And there's a chance that that kind of stuff might someday be included in a watch. I think you could measure surface temperature probably with those devices. But again, the challenge is that it's going to be that. It's just going to be surface temperature. And whether or not the wrist is an optimal place to measure a temperature that is reflective of the core temperature, I'm uncertain of. But given how far your wrist is from your chest cavity, I'm thinking it's probably not going to be ideal. And even if there's a sensor on the inside of the strap, the difficulty you're going to have is that is whether or not the temperature being measured under the strap in basically a locked away system, that is a space locked between the strap and the wrist, is going to give you accurate. I'm not aware of anybody working on that technology right now. But again, there's so much happening in this space right now that it's hard to keep track of it because it's moving so fast. And it's going in two directions. One is technology that will bring things to a better price point, and the other one is to just put together as much quick, cheap stuff that can be had to throw out on the market to basically capture sales with volume on low price, whether or not it works or not. As far as the wrist device, you'd have to have a way, of course, that would allow you in. The wrist device could certainly tell you your temperature. The challenge is going to be, how do you transmit that in a way that is in accord with HIPAA rules that will allow the building you're entering to automatically wave you in based on the temperature that was measured by your own watch. I think that's going to be the limitation, because the real purpose of this technology is to keep others safe from you, and you measuring your own temperature is one thing. Having that be a piece of data that's accepted as you walk into various buildings, I think is where the technological challenge will run into problems in that particular effort.
Okay, thank you. So we are right at the 11 o'clock mark here. So Bert, are you there? Bert?
I'm here.
Hi, Bert.
I
Bert,
was on courtesy mute.
you think do you want to give it another 5 minutes? We got a couple more questions to cover.
Sure. Anyone who needs to drop off can do that, but this has been very fascinating. So we'd love to get a couple of these questions in.
Okay, great. All right, so we got a question here about back to the system, the remote system. The question is whether these are working across platforms. So if you
Yes.
have Windows versus Mac, can you still operate these?
Yes.
Yes. Okay. All right, great. And actually, that may have been the last one that I didn't get to. All right, any other questions out there? Going
Just
on?
wanted to say hi, Dr. Fredo. I had class with you a million moons ago at Nuenco.
Thanks for reminding me that I'm a million years old.
Me too. Probably in '02, I think.
Okay.
It's good to see you.
Good to see you.
Okay. All right. So to wrap up here then, Dr. Fredo, are there any other points that you'd like to make that we haven't already covered?
I don't think so. You know, I'm sorry to leave you in this lurch of you know, we've got the one that's too hot and the one that's too cold, and the technology is still looking for the one that's just right.
We don't have to be
But
very-
at the moment, again, if you're going to do anything, I probably would encourage you to look into what's going to be the more expensive technology that will put your employees less at risk, and just find a company that's willing to do it on a payment plan that you could live with, and work on the assumption that the cost is going to be that the cost can be amortized, because I think this is going to be with us for at least a couple more years.
And so would you say that the NCITs are better than nothing or a waste of money?
The problem is you have to parse that out to a good one versus a garbage one. You know, you've already, as you know, as you said, you've already thrown some money at this technology and don't really have anything having spent that money, and you're from China. Based on my experience personally, the probability that you're going to get a refund isn't that great. So the question really is, how many people do I really have coming through? I think if you've got, you know, one person coming into your business every 15, 20 minutes, then maybe the more expensive technology that's more accurate just won't be worth it. But if you've got kind of a grocery store volume, and if you decide you're going to measure temperature at a grocery store or some other business where you've got a volume of people moving through, and you feel it is in everyone's best interest to measure their temperature, then I guess I would consider the more expensive technology.
All right. Well, this has been very enlightening. We thank you very much for your time. And if anybody would like to send you a follow-up question afterwards, is there a way that they can reach you?
Sure. I'm not sure. I thought the first slide had my email. The easiest.
Go ahead, I'll put it in the chat. Tell me what it is.
Easiest email is T as in Tom, 2 F's as in Frank, TFF, RE, then 2 D's and an O. So TFFREDDO@gmail.com.
All right. I just put that into the chat. And I thank you again. And I'm going to send it back to Bert.
All righty.
Thank you, Robin. Actually, you sent it to me personally. I'm going to put it in the chat for everybody here.
Thank you.
There we go. So, Dr. Fredo, thank you very much. This was very enlightening, and I think it was also some great information that folks can use right away. So we very much appreciate that.
Glad to help.
Thank you. And that's it for today. Go to cctechcouncil.org for information about some of our upcoming events. And we will look forward to seeing you all next week perhaps. Otherwise, enjoy the beautiful day and have a great weekend. So thank you all, everybody.
Thank you.
Thanks again,
Take
everyone.
care.
Thank you, Dr. Fredo. Bye.
Welcome. Bye-bye.
Thank you.